Hi, this is Dr. Can I just confirm your name and date of birth, please?
Mike Jones, it's 17th of February 63.
All right, thank you very much, Mr. Jones. How can I help you today?
Well, I don't know if it's a waste of your time. It's my wife asked me to ring you because she's been very worried. I went on the scale today and I've actually noticed I've lost 2 stone. It's just she asked me because I've lost weight to speak with you. But I don't feel like I'm unwell or anything. I was just hoping that just have a chat with you to see whether you could reassure me so that I can let my wife know. So I mean, like I know that I had to lose weight, so it was quite good for me to find out that I've lost 2 stone, to be honest. So I feel like I'm more healthy now.
Okay, Mr. Jones, is this weight loss unintentional? Have you been exercising?
No, I haven't really been exercising. I mean, I was thinking of I needed to do things to lose weight, but I haven't really started.
Okay, all right. Could you so did you tell me about how did this all start?
I don't really know. My weight is 15 stone normally.
Okay,
And then I just found out in the last 4 weeks, my weight's been going down. Some people have commented that I've lost weight,
okay,
which is why I got on the scale today to check. And then I found out I've lost 2 stone.
okay. All right, Mr. Jones. I'm gonna ask you a few questions. Have you noticed any lumps or bumps anywhere in your body?
No, I haven't.
Okay. Have you been suffering from night sweats or waking up at night with sweating?
No, I haven't noticed, no.
Okay. Any change in bowel habits?
My bowel habit, I've been having a bit of a runny stool in the last week, but apart from that, it's been fine.
Okay. All right. Any blood from the backside?
No,
No blood from the backside. Any change in your urinary frequency or weighing?
no.
Okay. All right. And have you noticed any pain in your tummy?
I do get heartburn. I've suffered
Okay.
with this reflux, so
Yeah.
sometimes it's quite bad, and I get heartburn with it.
Okay. All right. Have you noticed any lumps in your tummy?
No.
Okay. All right. So I can see from the file that you do suffer from reflux. Are they persist? Are they getting worse?
I found that it's been more frequent, to be
Mhm.
honest. I was given something called Gaviscon when
Mhm.
I had it, and it did help when I had it initially, but I think now it's not doing anything.
Okay.
So I think maybe my body's immunized to it. I don't know.
Okay. Any vomiting?
No, I haven't vomited.
Have you passed out? So you've not, no blood come out from your mouth, no vomiting.
No,
You're not suffering from cough.
no, I don't have a cough.
Okay, all right. Um, and can I also ask you, Mr. Jones, have you experienced any yellowing of your skin, or do you look pale?
No.
Okay. Any loss of wanting to eat?
I have found that my appetite has been reduced. Maybe it's because I don't want to eat because of this feeling of heartburn and
Mhm.
reflux.
Okay. Any symptoms of your heart beating, so any palpitations,
No.
and any intolerance to cold weather,
No, I haven't noticed. No.
and no shivering or tremors in your hands or anything like that.
No.
Okay, right. No swelling of your neck,
No.
no problems with your swelling,
Sometimes it feels like it's burning when I'm swallowing.
burning when you're swallowing. Okay, all right, Mr. Jones. Do you have any thoughts as to what you might have?
Well, I just felt like it was a bit of reflux. That's it.
Reflux. Okay, and are you particularly concerned about this weight loss that you have? And you did mention that you
Not really. My wife is just a warrior, so she
okay,
is panicking, I think. But
okay.
I don't really have any concern.
I hear you. And today, in terms of expectations, you did mention to me so that I can for me to reassure you. Is there anything else that you're particularly looking for today?
Maybe something like to take for this reflex, possibly.
Okay, to take for the reflex. All right, Mr. Jones. If I may ask, how is this affecting your life at home or life at work?
I mean, it's just been feel much better, to be honest. The fact that I've lost weight, I feel like I'm more healthy, and I can do more now. Whereas before I was feeling a little bit more lethargic. That's what I feel.
Okay. And can also see that you have diabetes. Can I just ask, is your sugar well controlled? When was the last time we checked?
Yeah, it's usually well controlled. I had blood tests about 6 months ago, and
Okay.
I think that was fine.
Okay. All right. All right. Thank you, Mr. Jones. I know that you want me to reassure you, but with the symptoms and the weight loss that you've mentioned, I think it's important to do a further investigations, like a camera test down your throat. What are your thoughts about that?
Camera test down my throat, is this needed, doctor? Because I don't feel like I'm unwell or anything.
Okay, Mr. Jones. It's just that you've lost 2 stones in the last month and in 4 weeks, and it's quite sudden. What we want to make sure that there's nothing serious going on,
Okay, serious, like what do you mean,
as
doctor?
in having weight loss that's all of a sudden 2 stones. I am concerned about you, Mr. Jones, in the sense, and we'd like to do a camera test to make sure that you're not having any kind of serious condition like cancer. What are your thoughts about that?
Well, I didn't think about cancer, to be honest. So you think it could be?
So, Mr. Jones, with your age and your symptoms, I think it's important that we do a camera test, just to make sure that you are that there is nothing sinister going on.
Right.
Yeah.
Okay, so this test then, will I be put to sleep to have this? Because I know people who had it and found it really painful.
Yeah, well, I hear you, Mr. Jones. What we normally recommend at this point in time is that we will request some blood tests,
Yeah.
um, and to check for the anemia, to check your liver, check your kidneys. And what we'd like to do now is actually, I'd like to do a 2-week weight referral to the specialist so that you are seen within 2 weeks and then they can schedule a camera test down your throat. What are your thoughts about that?
Right. Well, I mean, I wasn't expecting that I will have to have all the tests, but if you think that's needed, then I'll go with what you recommend, doctor.
Okay, so all right, Mr. Jones. I mean, it is important at this stage in time with the symptoms that you present to me that we make sure that there's nothing of that sort going on. What I will do for yourself is that I'd like to bring you in today. What we'll do today is we'll take your blood test and we'll do an examination. We'll have a feel of your tummy and we'll also check your basic observations like blood pressure and your pulse rate and have a listen to your chest as well. We want to make sure that there's nothing sinister going on, and I will do a referral to the specialist today for yourself. How does that sound to you?
Yeah, that sounds good. Yeah.
Okay, so what I will do ahead, and what I'll do ahead is actually book uh book you in today, and I will send you the time later today. Is that okay with you, Mr. Jones?
Yeah, yeah.
What I'd like to mention to you is that at this moment in time, we'd like you to have some support, and I can see that you from you what you've told me is that your wife is there with you. Would she be able to go with you to when you schedule for your camera test?
Yeah, yeah, I can also.
Okay, and I think it's important that you don't drive it that day. And you did mention about the pain and the uncomfortableness. Or we the after they've done an initial assessment for yourself, Mr. Jones, they do tend to put a local anesthetic spray at the back of your throat, and that can actually help. That can actually help with making the throat numb, and that can actually um, um, help with the discomfort if you if 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 you're experiencing that. How does that sound to you?
Yeah, I mean, I hope this is something that won't cause any problem, because I know like some people couldn't eat afterwards.
Okay. Well, what we normally say, Mr. Jones, is that it might be a bit uncomfortable less after a day or so after the procedure, but then it should get back to normal, and there is a very small risk of any adverse outcome, which is one in a less than 1 or 2 in 1,000. Although I don't know the exact statistics, um, but otherwise in general it is a safe procedure.
Okay, all right, yeah.
Okay. So I'll go ahead and I'll book you in. You come in today, we examine you, and then we take some blood tests, and then I'll refer you. Do you have any other thoughts?
No, I think that sounds all right. Yeah,
No,
that
I know
sounds
this is,
good.
I know when you call me, you weren't expecting this, but it's important that we make sure that to to rule that out. Is that okay, Mr. Jones?
Yeah, that sounds okay. Yeah, thank you.
All right then. Thank you very much, Mr. Jones.
Would you like an analysis of this case scenario? I break down this consultation and share my insights and feedback as to how this registrar could improve. Click the link down in the description below to get access to the case analysis. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care everybody. Bye bye.